First of all, let me commend and thank Chairman Neal and Ranking Member Brady for their cordiality and outstanding way in which they have managed the affairs of the Ways and Means Committee. And that is one of the reasons that we are here today with such an outstanding bipartisan bill to talk about the welfare of children and families. For struggling families, home visiting is a life-changing experience. Research demonstrates that home visiting works. I've seen these successes in my home city of Chicago. Parents and home visitors partnering to tackle big challenges and making children healthier and safer. My friend Jackie Walorski saw home visiting work in her district too. Jackie was deeply committed to helping vulnerable children and families, and she was my partner in our committee's effort to preserve and strengthen home visiting. I really wish she was here today as we continue with the work that we did together. I also want to thank our colleagues on the Energy and Commerce Committee, Chairman Pallone, Ranking Member McMorris Rogers, Health Committee Chair Eshu, and Health Subcommittee Ranking Member Guthrie for their leadership on this bill. The Jackie Walorski Maternal and Child Home Visiting Reauthorization Act would reauthorize the maternal, infant, and early childhood home visiting program for 5 years. Over the 5 years, the bill would double our federal investment in evidence-based home visiting, bringing home visiting to more families and communities. This bill would more than double our investment in tribal communities, where so many residents need home visiting but have been left out due to a lack of funding. It would invest in the critical home visiting workforce because it is the support and relationship that home visitors build with mothers, fathers, and children that make home visiting work. And it would ensure that states and territories have reliable, predictable funding and rules so that they can focus on helping more families thrive. The Ways and Means Committee passed this important bipartisan legislation on a unanimous vote of 41-0. And so I urge all my colleagues to join us in supporting the bill today as we work to enact it into law in the coming weeks. I also want to thank my colleagues at the Ways and Means and Energy and Commerce Committees for their input and support on the introduced bill. The bill also has the overwhelming support of home visiting stakeholders, including the Home Visiting Coalition, which endorsed the bill and wrote that it addressed every request the coalition made in a thoughtful and productive manner. We have an opportunity to make a real difference for children and families across America. And so I urge all of my colleagues to vote yes and then work with us to enact the bill this year, and I reserve the balance of my time.
The gentleman reserves. The gentleman from Ohio is recognized.
Well, thank you very much. Thank you, Mr. Chairman. Chairman Davis, I appreciate your work in bringing H.R. 8876, the Jackie Walorski Maternal and Child Home Visiting Reauthorization Act of 2022, through our committee, and I'm proud to support this effective legislation named in honor of our dear friend, Representative Jackie Walorski. Jackie had a servant's heart, and we shared not only a strong friendship, but a passion for creating opportunities to help others beyond just one day with life-changing measures and positive outcomes. In this case, those that are served are mothers and their new children, those that otherwise have many obstacles that can often lead to costly and negative health outcomes. Jackie worked tirelessly and passionately on this program with Dr. Davis. The Maternal, Infant, and Early Childhood Home Visiting Program is a program that is successful, and the data supports that. And what does success look like? A healthy mother with a caring support system, delivering and raising a healthy new child that is ready to grow, learn, and thrive. Earlier this year, I visited Every Child Succeeds, a Cincinnati nonprofit that helps support mothers and young children. During the roundtable discussion with local moms and home visitors, I heard firsthand how the Maternal, Infant, and Early Childhood Home Visiting Program, MCV as we call it, we heard how it is working. I also heard kids being loud and laughing, and I thought to myself, that's the sound of happy, healthy children. Our bipartisan legislation authorizes MCV for 5 years and will serve more moms and babies by growing the capacity of the program in partnership with the states. MCV is a successful program because, first of all, it does it by phasing in state match to vulnerable populations. And we will expand the research of evidence-based home visiting programs across the country by adding $174 million in new state funding. Second, we target funds to families in poverty by directing 3/4 of additional MCV funding based on the number of children under 5 in poverty in each state. And third, the bill improves outcomes reporting so more people will have visibility and access to the good work being done by home visitors. HHS will also be required to implement a state outcome dashboard, so we have more transparency on program performance measures and clinical indicators to show actual impact on families. And lastly, we apply lessons learned from the pandemic and allow virtual visits to continue on a limited basis while maintaining MCV's commitment to in-person visits and high evidence standards. As a physician, I'm very familiar with the evidence-based benefits of in-home support for both new parents and children. And I'm glad we're able to find common ground to provide stability for the program and the vulnerable families that the program serves. This program helps maternal and child health, family safety and stability, and readiness for school. People said to me on my visit, I don't think my child would be healthy without this program, but home visiting made all the difference for us. That's proof this program really works. I also want to take a moment to celebrate and honor my good friend and battle buddy, Jackie Walorski. I'm honored to continue her work here today. I can't think of a better way to honor her than seeing this bill through. She was a devoted public servant and cared deeply about this issue. Today, this morning, another dear friend of mine is unexpectedly being laid to rest. Another physician that believed in this program. Dr. Odell Owens, a well-known and loved healthcare hero in Cincinnati, Ohio, a man for others, a true public servant, my hero and mentor. Dr. Owens, as an OBGYN, brought the gift of life to so many, specializing in caring for expecting mothers that faced many challenges, always concerned about the health and well-being of the mothers that he cared for, as well as the babies he would bring into the world. Dr. Owens' services to the community extended well beyond the delivery room and into education, public health, and even served as coroner. Dr. Owens loved the MCV program and the long-term evidence-based positive effects that the program has had on so many lives and families. I can say with confidence that Dr. Owens and Jackie Walorski would strongly urge the reauthorization of this bill. With that, I'd like to thank again Chairman Davis and the late ranking member and dear friend, Congressman Walorski, for spearheading this issue and their work in the subcommittee. I urge my colleagues to support this legislation, and I reserve the balance of my time.
Gentleman reserves. The gentleman from Illinois is recognized.
Thank you, Mr. Speaker. And now it's my delight to yield 2 minutes to the outstanding gentlelady from California, Congresswoman Judy Chu.
Gentlelady is recognized for 2 minutes.
It was such an honor to work closely with the late Representative Jackie Walorski. I was consistently struck by her dedication to her district and deep desire to find ways to make our healthcare system work for everyone. On the Ways and Means Committee in particular, she and I worked together to co-lead bills on breast cancer equity and on medical nutrition therapy for those in the Medicare program with eating disorders. I also had the pleasure of co-chairing the Integrative Health and Wellness Caucus with her to help educate members of Congress on the various ways that integrative health can help support our traditional medical system and lead to improved care for patients. So I'm thrilled that we are honoring her legacy with today's bill, which reauthorizes the Maternal, Infant, and Early Childhood Home Visiting Program, or MCV. This bill also increases for the first time in a decade federal investments into the program. Home visiting for pregnant women and families with young children have a proven record of improving outcomes for children's health, well-being, and readiness for school. But currently, less than 5% of eligible families each year have access to the program, including in my own district in Los Angeles County. An estimated 37,000 families were served through evidence-based home visiting models in 2021 alone, but 750,000 more families were eligible for services during this same time, but could not receive them. In addition, recruitment and retention of home visitors are key challenges to adequately serving families. Low wages and poor benefits for the field is a main driver of these challenges, and additional funding is needed to address these workforce challenges and provide competitive wages to these vital providers. That is why I'm so excited about the investments in this bill, which will help increase capacity to serve those in need. I urge my colleagues to vote yes.
From Illinois reserves, the gentleman from Ohio is recognized.
Mr. Speaker, at this time I'd like to yield 1 minute to the gentleman from Nebraska, Mr. Smith.
Thank you, Dr. Winstrup, for the time, and thank you to both you and Dr. Davis for the work you've done to get this bipartisan bill to the floor. I rise in strong support of this 5-year reauthorization of the Maternal, Infant, and Early Childhood Home Visiting Program, which honors our late colleague and friend, Jackie Walorski. Jackie spent every day working in this body to improve the lives of families in Indiana and across the country, and enacting this bill, which enhances the ability of states and communities to help at-risk new parents care for and support their children, I think is a fitting tribute. I led the last MCV reauthorization 5 years ago when I chaired the Human Resources Subcommittee, and this bill actually enhances everything that MCV does right. It's a preventative program which keeps kids out of the child welfare system and saves money. It uses fact-based methods to ensure our support dollars are well spent. It asks states to provide matching funds so they have some skin in the game when utilizing this funding. And it is paid for within our committee's jurisdiction without raising taxes. MCV is a model for how our safety net should work, and I strongly support this bill. I yield back.
Gentleman from Ohio reserves. The gentleman from Illinois is recognized.
Thank you, Mr. Speaker, and it's now my pleasure to yield 2 minutes to the fierce defender of poor and disadvantaged people, the gentlewoman from Wisconsin, Representative Gwen Moore.
Thank you so much for yielding to me, Mr. Chairman. I rise to provide enthusiastic support of this bipartisan bill to reauthorize the Maternal, Infant, and Early Childhood Home Visiting Program, now to be named after our late marvelous colleague, Ms. Jackie Walorski. This strong reauthorization for 5 years would provide additional funding. It would double the tribal home visiting set aside to respond to the needs of tribal communities for home visiting and address workforce shortages, among other things. Now, home visiting is not just some feel-good policy. As my colleagues on both sides have indicated, it has been repeatedly evaluated and consistently proven to provide and improve outcomes for families and children. And we have good data that shows that it works. Importantly, we have families that are stronger because they have gotten the help that they needed when they needed it. We have new moms, for example, who have access to help at critical points as they try to navigate this exciting but frightening moment in life. Oh my goodness, it reminds me of when I was 18 years ago, some 50 years ago, and had my first baby and a home visitor, had a baby who had an asthma attack 4 days after birth, and I didn't even know how to change a diaper. The home visiting program was a fail-safe for me. I think, too, of women like Brittany who live in my community who benefited from Children's Hospital's Healthy Families Milwaukee County Home Visiting Program 8 years ago, but then reached out to the home visiting program earlier this year for help again because she was now pregnant again after a recent cancer diagnosis. Brittany trusted her home visitor to help guide her through this pregnancy as they had supported her in the past. They were able to set up home visits, taught and helped Brittany advocate for her own health care for herself as well as her unborn child, and supported the entire family. And when they asked Brittany what was the most valuable thing that she got from the program, other than, of course, all of the plethora of help, one of the things that struck me was that her home visitor helped her to learn to trust her own instincts, something that you gotta have if you're a mom. Thank you, Mr. Chairman, and I yield back to you, sir.
Gentlelady yields. Gentleman reserves. The gentleman from Ohio is recognized.
Mr. Speaker, I yield 2 minutes to the gentleman from Illinois, Mr. LaHood.
Gentleman's recognized.
Thank you, Mr. Speaker, and I want to thank Dr. Winstrup and Mr. Davis for shepherding through this legislation. I rise in strong support of H.R. 8876, the Jackie Walorski Maternal and Child Home Visiting Reauthorization Act of 2022. The McVie program has over 2,700 participants and has conducted over 17,000 home visits in my home state of Illinois, including in the Peoria and McLean counties and throughout my district. I understand how important it is to support families, women, and children with evidence-based services to mitigate maternal and infant mortality risk factors and improve overall health outcomes, particularly in rural and underserved communities. Evidence-based programs, including home visits by nurses, social workers, or early childhood professionals, have improved maternal and newborn health services that mothers and infants can count on to help set them up for success in the future. I also want to acknowledge and take a moment to recognize Congresswoman Jackie Walorski, the former ranking member of the Worker and Family Support Subcommittee. She was a wonderful colleague and friend who is deeply missed every day in this body. Passing this legislation today is a recognition of Jackie's tireless advocacy for the renewal of McVie and a testament to her remarkable legacy. We honor her today with passing this legislation, and I urge my colleagues to support this bill and everybody in this body to honor Jackie. Thank you.
The gentleman from Ohio reserves. The gentleman from Illinois is recognized.
Thank you, Mr. Speaker, and it's now my pleasure to yield 3 minutes to the outstanding gentlelady that many of us call the pride of the South, Representative Terry Sewell.
Thank you, Mr. Chairman. I rise today to offer my support of the bipartisan Jackie Walorski Maternal, Infant, and Early Childhood Home Visiting Reauthorization Act, or MACV. This legislation represents not only a commitment for me to the mothers, children, and families in my district, but it also reflects a sincere love and respect that this committee has for our late, great, wonderful colleague, Jackie Walorski, and the much work that she did on the Ways and Means Committee as chair of this amazing subcommittee. Currently, over 1,800 pregnant women and new mothers throughout my district in Alabama receive services from the MACV program. The actions taken today by the House will ensure that these families will have access to the essential early childhood care that they so critically need for proper growth during a mother and a child's early developmental years. Increased access to home visitation services, including postnatal care and screening for postpartum depression, will guarantee that women, especially those women of color in my district, can continue to have regular access to medical professionals, thus giving them the opportunity to have the highest care offered. Specifically, in my district, the women, children, and families of Dallas County, Lowndes County, Montgomery, Perry, and Wilcox counties are poised to benefit from this reauthorization. I ask my colleagues to join me in supporting this. What a wonderful tribute to an amazing public servant. It was an honor not only to work with her, but to call her my friend. Let's vote yes to reauthorize this amazing program. Thank you, and I yield back the balance of my time.
Gentlelady yields back. The gentleman from Ohio is recognized.
Mr. Speaker, I yield 3 minutes to the gentleman from Texas, Mr. Brady, and the ranking member of the committee.
Gentleman's recognized.
Thank you, Mr. Speaker. This week we honor the legacy of Representative Jackie Walorski by renewing our commitment to help moms and babies thrive. I want to thank Chairman Davis, and I want to thank our Republican leader, Dr. Winstrup, for your leadership on this issue. Throughout her life, Jackie served vulnerable families, from the mission field in Romania to the halls of Congress, where she proudly represented the men and women of Indiana's 2nd Congressional District. She reached across the aisle and worked closely with Chairman Davis to move this important bipartisan bill forward. My last conversation with Jackie was by Zoom on this bill itself. We miss her very much. We're proud to dedicate the product of her collaboration today to her. That's because she's been such an inspiration to these efforts. Jackie knew that this was a critical program that supports vulnerable families and improves the health of moms and babies through pregnancies into the early years of a child's life. This program builds upon decades of research that proves home visits by a nurse, a social worker, or other trained professional during pregnancy and in the very first years of a child's life helps to prevent child abuse and neglect, supports positive parenting, improves the maternal and child health, and promotes the development of the kids in school readiness. This is a bipartisan bill that reflects many of our Republican priorities, including increasing transparency about outcomes and results for families and targeting dollars to the neediest communities. Most federal programs unfortunately operate in a black box. Less than $1 out of every $100 the government spends is backed by even the most basic evidence and research to make sure the money is spent wisely and succeeds. But unlike many of those programs, MACV is evidence-based, so we know the real impact on families and children. We're able to direct funding toward what works for them. The Walorski Home Visiting Program will gradually increase funding from $400 million a year to $800 million a year over a 5-year period and introduces a state match so we can stretch those dollars even farther back home. The principle is simple. Where the states see value in investing, the federal government will also invest. It also ensures the new matching funds are allocated to states based on the number of kids under 5 living below poverty. So funding goes where the need and the kids are. The bill increases transparency by creating what I love, which is a state-by-state outcomes dashboard. So all of us can see how these interventions are helping families and maintains the current focus on high standards. So I want to take a moment to thank my friend, Dr. Representative Winstrup, who served as acting Republican, serves today as acting Republican leader, the Worker Family Support Subcommittee. You stepped up to the plate to carry on Jackie's legacy with grace and determination, so thank you for your hard work. And I think all of us can think of no more fitting tribute to Jackie than the bipartisan support coming together for something that helps our most needy families. I, like many of us today, are grateful we're getting this bill across the finish line together in her honor. With that, Chairman, Speaker, yield back.
Gentleman yields back. Gentleman from Ohio reserves. The gentleman from Illinois is recognized.
Thank you, Mr. Speaker. I have no further requests for time, so I reserve.
Gentleman reserves. The gentleman from Ohio is recognized.
Mr. Speaker, I yield 1.5 minutes to the gentleman from North Carolina, Dr. Murphy.
Thank you, Mr. Speaker. I rise in support of the Jackie Walorski MIE-CHV Reauthorization Act. Maternal, infant, and childhood home visit programs support pregnant women and their young children with evidence-based approaches that improve maternal and child health outcomes for the most vulnerable. Over the last 30 years, I have taken care of many single mothers who struggle to take care of their children. Sadly, the problem is only getting worse with the explosion of fatherlessness in this country. This is a program we all wish didn't need to exist, but we are all very glad that it does. This is actually when the government gets it right. I've personally been in these homes when I was in the state legislature, and these young women desperately need our help. Even more so, the children of these single mothers need our help. This program will help young mothers get the help that they need for their children. These are not handouts, these are hand-ups. This is what government is supposed to do. I am proud of our colleague and dear friend, the late Congressman Walorski, for her dedicated leadership on behalf of women and babies throughout the country. Jackie shined a bright light in this chamber and was resolute in her love and support for American families. This bill cements her legacy and will improve the lives of millions of Americans for generations to come. I am honored to support this legislation and urge all of my colleagues to vote for the Reauthorization Act in honor of Jackie Walorski. Thank you, and I yield back.
The gentleman yields back. The gentleman from Ohio reserves. The gentleman from Illinois is recognized.
Mr. Speaker, I continue to reserve.
The gentleman reserves. The gentleman from Ohio is recognized.
Mr. Speaker, I yield 3 minutes to the gentleman from Pennsylvania.
The gentleman is recognized.
The gentleman from Georgia, Dr. Ferguson.
Thank you, Mr. Speaker. I'm honored today to stand here to honor our dear friend Jackie Walorski and her tireless efforts on this piece of legislation, the Jackie Walorski Maternal and Child Home Visiting Reauthorization Act of 2022. And this legislation is important because it really does provide needed services to our most vulnerable. And just in the state of Georgia, this program produced over 20,000 home visits and really had an impact on families with early development, mental health, substance abuse, but there are a lot of other things that some incredible nurses did. And this program is being reauthorized with some much needed reforms in it. There's going to be stability in the program. And Jackie fought hard to make sure that this program was based in evidence, so the dollars will go where it works. And so I'm honored to be here today to support this legislation, but more importantly, I'm here to honor our dear friend Jackie Walorski. Yield back.
The gentleman from Ohio reserves. The gentleman from Illinois is recognized.
Speaker, I continue to reserve.
Gentleman reserves. The gentleman from Ohio is recognized.
Mr. Speaker, I yield 1 minute to the gentleman from Georgia, Mr. Carter.
I thank the gentleman for yielding. Mr. Speaker, I rise today to express my support for H.R. 8876, the Jackie Walorski Maternal and Child Home Visiting Reauthorization Act of 2022. This bill is a critical piece of legislation that will help mothers and children at every stage of life. The Maternal, Infant, and Early Childhood Home Visiting Program reaches new parents and their children from before birth through kindergarten with in-home support. In meeting with families in the program, I've seen firsthand how effective this program is at improving maternal and child health, family safety and stability, child development, and readiness for school. In my home state of Georgia, we have the highest rate of maternal mortality in the United States. I've worked on this issue since I was a member of the Georgia State Legislature, and it still baffles me why Georgia has the highest rate. But by passing this bill, not only are we addressing maternal and newborn health, we're also furthering Representative Walorski's legacy, who dedicated her life to helping others. I can think of no better tribute to our dear friend who departed us far too soon. For these reasons, I look forward to supporting this bill, and I encourage my colleagues to do the same. Thank you, Mr. Speaker.
The gentleman from Ohio reserves. The gentleman from Illinois is recognized.
Speaker, I continue to reserve.
The gentleman reserves. The gentleman from Ohio is recognized.
Mr. Speaker, I yield 3 minutes to the gentleman from Pennsylvania, my friend Mr. Kelly.
Thank you, Dr. Wenstrup. Dr. Davis, thank you. So I'm standing beside this picture of Jackie Walorski, and anybody that ever knew Jackie knew this is the way she always looked. And this bill today that we're talking about reveals who she really was and still is. She's born August 17, 1963. She passed on August the 3rd, 2022. 59 years on earth. 59 years of a servant's life. Jackie Walorski never did anything for herself to advance herself. Her main concern were the mothers that she worried about and the children that she worried about, because she knew that was America's greatest asset. She knew that everything she did in her life was not about her, but was about others. She brought such a new concept to the floor, the People's House, to not only transform it in legislation, but to change people's hearts. She would never talk about herself as a representative or congresswoman. She was always here for others, not for herself. And when we look at legislation from time to time, we start to think about, what is it that we're really doing? What are we asking our taxpayers to invest in? If it's not our future, then why are we here? The most important asset for Jackie Walorski was expectant mothers, infants, and child care. She was truly unusual. But in her 59 years, she did so much to help so many. And I think for us to be here today on the People's House, on the floor, and to be able to share who she is. I said August the 3rd, she passed. The only difference is Jackie's not here in person, but she's looking down from her spot in heaven and smiling the way she's smiling in this picture, because that is the essence of who Jackie Walorski was. We all loved her, we all miss her, and we know we'll never replace her, but we sure thank God for giving her to us for 59 years. Dr. Wenstrup, thank you so much. Dr. Davis, thank you so much for bringing this forward. And I cannot believe anything other than a complete yes from every single member of the House on this. Thank you, and I yield back.
The gentleman from Ohio reserves. The gentleman from Illinois is recognized.
Speaker, I reserve.
Gentleman reserves. The gentleman from Ohio is recognized.
Mr. Speaker, I yield 1 minute to my neighbor, the gentlelady from West Virginia, Mrs. Miller.
Thank you, Mr. Speaker. Today, I rise also in support of the Jackie Walorski Maternal and Child Home Visiting Act of 2022. Programs like these are essential, and they deliver meaningful results that strengthen our families and our communities. In West Virginia, McVie program has made over 21,159 home visits, served 1,556 families, and impacted over 1,493 children. The program supports our vulnerable pregnant women, and it comes alongside parents with young children to ensure that they all have the resources that they need to raise their children. I also, of course, want to take a moment to recognize my dear friend and colleague, Jackie Walorski, who this bill is named after. Jackie was my mentor in Congress when I first came here, and she very quickly became my friend. We shared meals together, good conversation, and her office was even directly across from mine in the same hall. It was my pleasure to serve alongside her on the Workers and Family Support Subcommittee. Her leadership and her passion for these issues are reflected in this bipartisan bill. I urge all my colleagues to vote in favor of this resolution. Thank you. I yield back.
Lady yields. The gentleman from Ohio reserves. Gentleman from Illinois is recognized.
I continue to reserve.
Gentleman reserves. The gentleman from Ohio is recognized.
Mr. Speaker, I yield 1 minute to the gentleman from Kansas, Mr. Estes.
Mr. Speaker, I rise today to honor our friend and colleague, Jackie Walorski, with a cause that's near to her heart, the Maternal, Infant, and Early Childhood Home Visitation Program, also known as the McVie Program. Jackie lived a life of service, not just as a member of the House of Representatives, but as a missionary for 4 years in Romania, where, not surprisingly, she worked with a lot of children. She championed children and families in her role in the Worker and Family Support Subcommittee and always advocated for the Hoosiers she represented. In her honor today, we're going to pass this critical bipartisan legislation reauthorizing a program that's whole purpose is to ensure that mothers and children do not fall through the crack. Families will be able to be met where they are and connected to a host of support systems. Earlier this year, I visited with some early childhood supporters in Wichita, and the McVie program was something that they repeatedly told me was important for the work they do and the families that they serve. I look forward to seeing strong bipartisan support today to pass this bill, lift up children and families, and honor our friend Jackie. Thank you, and I yield back.
Gentleman yields back. Gentleman from Ohio reserves. The gentleman from Illinois is recognized.
I continue to reserve.
Gentleman reserves. The gentleman from Ohio is recognized.
Mr. Speaker, I yield 1.5 minutes to the gentlelady from Missouri, Mrs. Wagner.
Without objection.
I thank my dear friend, Dr. Brad Wenstrup, for yielding to me. And Mr. Speaker, I rise in strong support of H.R. 8876, the Jackie Walorski Maternal and Child Home Visiting Reauthorization Act. I'd like to commend Chairman Neal, Chairman Davis, Ranking Member Brady, and all the members on Ways and Means for bringing this legislation to the floor and honoring our late colleague and my dearest friend, a selfless servant, Jackie Walorski. The McVie program is backed by decades of research that prove home visits by a nurse, social worker, or other trained professionals during pregnancy and in the first year of a child's life supports positive parenting, improves maternal and child health, and promotes child development and school readiness. This program has proven vital to families in underserved communities, especially in my home state of Missouri. Life is a beautiful and precious gift, and all babies deserve the opportunity to thrive. Women need a strong support system as they navigate the miracles and the challenges of motherhood. This legislation that embodies my dear friend Jackie Walorski was very close to her heart. It will give women, especially the most vulnerable, the support they need to build a happy, healthy future for their children. Right now, Jackie Walorski is shining down on this institution and on the people of Indiana's 2nd District. All our love to her dear husband, Dean, her mother, Mert, and all of those that served with her. I yield back the balance of my time.
Gentlelady yields back. The gentleman from Ohio reserves. The gentleman from Illinois is recognized.
Speaker, I have no further speakers, and I'm prepared to close after the gentleman from Ohio.
The gentleman reserves. The gentleman from Ohio is recognized.
Now, Mr. Speaker, I yield 1 minute to the gentleman from Indiana, Mr. Yakum.
Gentleman is recognized.
I thank the gentleman for yielding. I rise in support of H.R. 8876, the Jackie Walorski Maternal and Child Home Visiting Reauthorization Act. On behalf of Indiana's 2nd District, I'm grateful to the entire Ways and Means Committee for their work in putting together this bipartisan legislation and honoring Jackie in such a meaningful way. Jackie spent her life as a tireless advocate for hardworking Hoosiers across the 2nd District. In particular, she put a tremendous amount of time and effort towards the reauthorization of the McVie program. I urge my colleagues to support, and I yield back.
Gentleman yields back. The gentleman from Ohio reserves. The gentleman from Illinois is recognized.
Speaker, I continue to reserve.
Gentleman reserves. The gentleman from Ohio is recognized.
Mr. Speaker, I'm prepared to close.
The gentleman from Ohio is recognized.
I want to thank everyone involved with this really wonderful moment that we're experiencing here on the floor, not only in memory of Jackie Walorski, but in the work that she put in and how much was accomplished here, especially in a bipartisan fashion, on behalf of so many people across America that are going to benefit from this great program, the mothers and the children especially. I want to take a moment to thank Jackie's husband, Dean, who shared Jackie with us here in the House of Representatives, where she was able to do so much good work, and this being one of the very highlights of her career that spoke so much about who she was and who she is. It's a special moment for me, as I know my friend, Dr. Owens in Cincinnati, who took care of so many mothers that benefit from this program, is being laid to rest today, and he was so proud of what we were doing with this program. Well, he's with Jackie now. But we're all blessed. We're all blessed to have had so much hard work put into this across the aisle. When I thank Chairman Davis, you worked tirelessly on this as well. This was definitely a dual effort. And I'm grateful for all those that have participated, to the entire committee, the Ways and Means Committee, to the subcommittee, and to all those involved. And I'm very proud that we are moving this bill forward today. And I urge this reauthorization, and I encourage all of our members to support this wonderful program. And with that, I yield back the balance of my time.
Gentleman yields back. The gentleman from Illinois is recognized.
Thank you, Mr. Speaker. Let me first of all thank you, Dr. Winstrup, for your leadership. And I also want to thank all of those who have spoken to the virtues of the bill, as well as the virtues of Jackie Walorski. You know, I was able to attend her homegoing services, and I can assure you that if you was in Mishawaka or South Bend, Indiana, you'd hear the same words that have been spoken here today. She was indeed an amazing woman. I also want to mention before I close another amazing woman who has been legendary and become legendary in this institution, and that is our dearly beloved Speaker, Nancy Pelosi, who has led this body for a number of years. And I think that this can indeed be one of its proudest moments. As I close, I want to close by quoting Erica Beck, who receives home visiting services in Chicago. And at one of the hearings we held, Ms. Beck said, and I quote, "I know that our lives are changed forever, and for the better because of Mia, our home visitor. She is helping me and Louis, my husband, help our kids succeed, and she is educating all of us." And such is the feeling that those who receive these valuable services. I also want to take this opportunity to thank all of the organizations and individuals who've joined our fight to continue and expand home visiting. And I thank the bipartisan Ways and Means staff, Staff Director Marta Miller, Taylor Downs, Cheryl Vincent, and Andrew Gratson. I also thank the tremendous nonpartisan staff that my staff and I relied upon so much throughout the process. Patrick Landers and Karen Litch at the Congressional Research Service, James Grossman at the Office of Legislative Counsel, Carolyn Uglano at the Congressional Budget Office. And I also want to thank my legislative staff director and Deputy Chief of Staff, Dr. Jill Hunter Williams, who put in so much time, energy, and effort on this bill. I also thank all of those who worked with her. I've had some proud moments in this body, but I can tell you that there's no prouder moment that I've had than to have before us and to suggest when we vote for this bill, for this home visiting opportunity for thousands and thousands of children and mothers and families to experience the help that they need to become everything that America has the potential of helping them to be. So again, it's an excellent piece of legislation. I urge its passage and yield back the balance of my time.
Gentleman yields back. All time for debate has expired. Pursuant to House Resolution 1499, the previous question is ordered on the bill as amended. The question is on the engrossment and third reading of the bill. Those in favor say aye. Aye. Those opposed, no. The ayes have it. Third reading.
H.R. 8876, a bill to reauthorize the Maternal, Infant, and Early Childhood Home Visiting Program and for other purposes.
The question is on the passage of the bill. Those in favor say aye.